After you've birthed your baby, the midwife will lift them onto you straight away before the cord is cut. That skin-to-skin contact will help to keep them warm and calm and steady their breathing. It's also an amazing bonding experience for you and your baby. Your baby may have some of your blood on their skin or be covered in vernix. That's the white creamy substance that protects your baby in the womb.
When your baby is inside the womb, they'll get all their oxygen through your umbilical cord. Once they are born, they will start to breathe on their own. Occasionally, some babies need a bit of extra help to support them. In some cases, your baby may be taken to another part of the room to have some oxygen, while they'll be brought back to you as soon as possible. The midwives will explain what is happening if a baby needs an extra bit of help.
Whilst you're having your first skin-to-skin with your baby, this is a great time to try your first breastfeed if you want. Your midwife or support worker will be there to help you with positioning your baby and helping your baby to latch on.
Following the birth of your baby, you will still need to birth your placenta. The baby's umbilical cord will be attached to your placenta. It will still be pulsing and passing blood to your baby for 2 to 4 minutes after birth. The cord will not be cut until it has stopped pulsing or until you're happy for it to be cut. This provides additional oxygen and red blood cells to the baby to help them in the first few days of life.
There are 2 ways to birth your placenta. The first is to birth the placenta naturally. You'll feel some more contractions. They're usually less intense than what you've been having, and you can just push the placenta out. This can take up to an hour for the placenta to come away, but usually it takes a few minutes. The second is for the midwife to give you an injection of oxytocin into your thigh. The oxytocin makes the placenta come away from your womb, so your midwife can use the umbilical cord to gently pull your placenta out through your vagina. The injection reduces the amount of blood that you lose when the baby is born and can speed up the delivery of the placenta. The Royal College of Obstetricians and Gynecologists recommend this injection to reduce blood loss at birth. Your midwife or obstetrician will be happy to discuss this so that you can make an informed choice.
Your baby will be examined by a midwife or pediatrician and then weighed and sometimes measured. The midwives will put a hospital band on their ankle with your name on it. Your baby may also have an electronic security band on, depending on where your baby is born.
You'll also be offered an injection of vitamin K for your baby. This helps to prevent a rare bleeding disorder in newborns. If you prefer for your baby not to have an injection, then your midwife can give the vitamin K by mouth, but you will need to get further doses over the coming weeks.
Your midwife will need to examine you to see if you've had any tearing during the birth. Small tears are often left without stitches because they tend to heal better on their own, but larger tears are recommended to be stitched. Your midwife can do this and can give you a local anesthetic to numb the area. You can help holding your baby while this is happening, or you can give your baby to your support partner and they can also give your baby skin to skin. You will be offered food and drinks, and you can then go and have a shower or bath and freshen up before you and your baby are transferred to a postnatal ward or discharged home.